Welcome, 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 welcome. This is our fourth episode. Just want to bring in Danielle Doyle. Welcoming summer. How you doing, Danielle?
I am good today. Just got done hanging out outside in the beautiful sunshine. I'm excited to talk to our special guest, Melissa Calabria, today. As you know, she's doing a lot of work for the community. She does a lot of work feeding families that are in need in her area. So that's what we can expect to talk to today.
Yeah, it's
Really,
amazing, amazing process that she does, man. Amazing woman. I can't wait.
yeah, it's going to be really good. You guys are going to love it. This is actually, yeah, it's our fourth show, technically our third one, but yeah, we're having a really good time here. If you guys are loving it, I want to invite you to like us, hit the like button, subscribe, and follow along with us. See You Next Tuesday is just getting started. We're on YouTube and we're on Facebook, we're on Instagram, and pretty soon we're going to be on Spotify.
We're actually going to be on iTunes as well. We're just
iTunes.
kind of, yeah, we're just basically testing the waters with the YouTube, and it's been working out pretty well. It's been pretty fun, and honestly, we're just like talking about whatever. So, been having a good time with it, honestly.
Yeah, definitely. We love it. We enjoy it every week, and we have a laundry list full of people that we can't wait to bring on here. If you feel that you're inspirational and you're a nurse, or you're not a nurse and you're inspirational, but you have something that you want to share, a platform is always open to you. So feel free to reach out to us. You can reach me at my email. It's info@accesshealthcarestaffing.com. And again, don't forget to subscribe and like us. So, like Diego said, we're entering in the first week of summer. We're beginning to see a huge change in not only the weather, but the way that the nursing trend is moving. A little update on the staffing industry this week for Access Healthcare, which is the basis of this podcast, our company. And by the way, we're now in about 30 states around the country, so we're growing rapidly by the minute. We're happily seeing an increase in jobs. As you know, COVID-19 created a huge crisis where all of the hospitals were inundated with patients, and we were inundated with crisis positions. And once it flattened out, we saw a huge influx in cancellations. I'm sure all of you nurses out there know exactly what we're talking about, and it's been kind of weird because this tends to be a steady industry. But this past week, we've been seeing a lot more positions popping up. So that's good news for you guys, and it's good news for us, certainly.
Yeah, yeah. We were kind of worried with the flattened out rates, and a lot of people, what I've been seeing online, like on social media, actually, it's been a lot of people wondering COVID rates continued, but eventually, unfortunately, it's running out. So we really have to kind of settle in the prices that are offered to us now. So, but we have to plug in once again, like I do every week, is that we are the highest paying company. Even before COVID hit, we're paying $300 to $400 more a week than most companies. So that's almost two car payments you're missing out by working for the big guys. If you work for the big guys, they have a lot of overhead, a lot of people that they use in their office that they have to pay salaries to. And where do you think the money comes from? You. So just make sure you realize that. You got to come to Access Healthcare and let us quote you at least before you sign any type of contract. We can help you through everything. But yeah,
Like, yeah, so that's some good news about us and good news about the industry. Things are turning up, and you can expect things to get back to normal. And everybody that's coming off the crisis positions can happily hop into a regular position, and the timing is working out perfectly. Um, some other things that we're still working on over here at Access Healthcare. Again, you can expect our store to be opening up soon. Um, what else are we working on? We're working on NurseFly. We're going to be getting our jobs live streamed.
on our website, our fabulous website
Oh
that there
yeah,
are people working on as well. It's just it's an amazing thing. We just want a bigger platform, and we just want people that our website not even just to be a hub for a lot of different things. As you saw, Tommy Notoriani last week came on, spiritual life coach, talking about fear doesn't exist. We'll be able to upload see all of our shows on our website and our store, which will open up soon as well. So, got a lot of
yeah,
exciting things happening. A
it is,
lot.
and that's what makes us different than other agencies. Is we're actually people. When what other time do you get a chance to meet the people who actually created the company? The big companies I used to work for, I don't even know who owns them. I have no idea. With us, you can talk to us anytime. So
Yeah, have a
that,
drink with us, have a shot with us. Yeah, whatever.
yeah,
Here
anything
we
you
are.
want.
Yeah.
Exactly. And that's how we want it. We
I'm
want
gonna
it
give you. I'm gonna give you Danielle's address. Matter of fact, you can just show up at her door whenever. No, I'm kidding. She's a phobic for germs actually. So I don't
I'm
think
a
that'll happen.
germaphobe, really?
Yeah, slightly, a little bit. Yeah.
No, I'm a peopleophobe. But either way, thanks, Diego.
Hey.
Uh, so if you like our wacky humor, again, subscribe, follow us, check us out, share. Melissa is patiently waiting for us, so I do want to bring her in. You guys are going to love her. She is one of our nurses, one of our OG nurses. She's been with us for, I'm going to say 2 years, but I don't want to insult her if it's been a little bit longer. But, you know, Access Healthcare has been around for 5. She came in maybe 3 years ago. I will have to ask her, but she's wonderful. She's doing great things for the community. I'm not even sure if she sleeps, when she sleeps. I don't even think it happens, but let's get her in here, say hi, and I'll tell you guys all about her. Let her share a bit about what she's got going on and why she is awesome. Hi.
What's up, Melissa?
Oh, not a whole lot. Recovering from my shift.
Oh my God. You worked yesterday. Thank you for being on. I know you worked and slept a little bit.
I did. Yeah, absolutely. Thanks for having me.
Yeah. No,
Definitely.
we want to invite inspirational people on, just to tell your story and stuff like that. I think it's
Mhm.
amazing what you're doing, but yeah.
Yeah, I was telling them a little bit about you before we got started, but
Okay.
if you wouldn't mind sharing a little bit about yourself, your family, and the one thing I really want to know is why nursing? Like, why did you get into it? And why is it important to you, and how has it impacted your life? Just all those questions.
Damn, man,
Okay.
slow down, son.
Don't worry, I got my notes.
Okay, good.
Actually, so I'm married to my husband, Matt. He's also a nurse.
Amazing.
And we have 4 children together. I have 2 children from my previous marriage. So I have 6 total. Never in a million years did I think I would do travel, because I'm definitely a creature of habit and not wanting to pick up and move and be uncomfortable for a short period of time. But it was definitely in the cards. When I left my last job, I thought, well, why not try it? So nursing, why nursing? It took me a little while to figure out that I wanted to be a nurse, but I've always loved pathophysiology and I've loved anatomy, all that stuff. Medical field was just something that I was really interested in. Initially did not go into that. I started going to college for preschool teacher, and then I started having my own kids, and I thought, no, don't want to do that. So went into nursing, and I have my bachelor's degree now, and I graduated in 2002. So I've been a nurse for quite a while. And as far as what it's done for me, an enormous, it's been probably one of the most rewarding things, other than being a mom, that I have done. And I would not do anything else. I couldn't see myself, not even in management. Bedside nursing is my thing. I love it. Is it stressful? Yes. But at the end of the day, coming home, knowing that I've been able to help people, sitting at some, going from like a birth to life and death is like just an incredible thing. And most lay people don't get to experience that. I feel like seeing the advances in technology, just crazy from one hospital to the next, has been amazing to see the difference in different hospital systems, hospitals themselves, smaller versus bigger.
It's kind of cool how you can implement different practices into your own practice. You become
Yes.
a universal soldier because you're able to try different things, have different facilities and positions and policies
Exactly.
and procedures. It's amazing. That's a good point.
Yes. It's definitely made me, I've always been one of those people that people with problems gravitate towards. My husband's always like, oh my God, here she goes again. Somebody's got a problem. So it's definitely been good for me because I like to sit down and talk to people. I'm not a person that goes in, does my job and walks out. I love to talk. I love to figure out where people came from. And it's been just very rewarding to me to have that part, that piece of my life there.
You're very good at what you do. My conversations with you in the past have been just really good. And my history with the company you working with us basically has been great. And I just know what's type of nurse you could be. But this whole COVID-19 just kind of landslided everybody.
Yeah.
And it's really my concern for people, and we're going to have a guest in the future is going to kind of help us with the possible PTSD that we're going to go through because
Mhm.
the stuff that we saw. I mean, yes, we see a lot of death, but at that volume, how's it impacted you personally? Have you had feelings that are resurfacing? Uh,
Oh, for sure. I mean, I feel like when our hospital or our smaller hospital was bombarded in their ICU, they were looking for volunteers of people who might have critical care experience, who might be willing to learn things, to go and kind of buddy up in the ICU. So I did go over. I was there for about a month. And it was tough. These people were so sick. And the amount of care that they required, between all the PPE that needs to be used, all of the isolation of just one room, nothing leaves the room. It was horrendous. And it was a lot of, I think what made it hard was the fact that the families couldn't be there. And that was really difficult. There were days where we would take telephones in with wives or husbands on the phone talking to their loved one who was on a ventilator and not responsive. So it was really hard to watch that. But it was rewarding to see that there were some people that got better. There were people that we took off the vent that made it and walked out. But then there was those that didn't, and young people, old people.
Yeah.
It was,
Colleagues too, like our own people,
yeah,
our
yeah.
original learners. But I'll tell you one thing, like this pandemic hit and it really affected the economy. But I was very truly inspired by you. I was happening to look on Facebook one day and I saw that, with this pandemic, the economy is hit. A lot of people losing their jobs. They need clothes, they need food, the basics.
Yeah.
And just to see your post, can you tell us basically why you came up with and why you did the things you did and exactly maybe the process, what you did for these people?
Yeah. So basically what I was concerned about was hearing about all these layoffs, people not going to have work. And I know the unemployment process is dreadful. And it can take a while to actually get some funding. So, my husband and I are blessed that we both have jobs and we were both in dire need. So we were able to continue working and people were losing jobs. So my thought was, why not give back to the community something that's needed, and our basic necessity is food. So we took some money of our own, we started it. I started packing in groceries in bags with my kids, and would go to the grocery store. We would plan out meals, there would be like 3 meals in a bag for like a family of 4. And we started out with 10 bags and we would just line them up on our front walkway. And I started promoting it and putting it out onto Facebook into our local community groups. And it really just took off. The community, then I had people that were dropping donations on our doorstep like a couple of times a day. People were mailing in checks. People were sending stuff through Venmo and PayPal and stuff. So it was at that point, we were just putting the work in. Our community was actually funding it. So we've been doing it now for probably 2.5 months, maybe. Yeah, probably about 2.5 months. And so we ended up getting up to like 15 bags of groceries. We started with 10 bags, and then we got up to, right now at 15 bags. So we pack up 15 bags of groceries every Monday, Wednesday, and Friday. And then we put them out at 9 a.m. And at this point, the word got out and they're gone within an hour. People just come and pick up. And we have a couple of people who actually come, and I've gotten friendly with, who are delivering to like local elderly people who can't get out to grocery shop. So they've been picking up a few bags each day and delivering them and helping me that way.
Did you?
And then we had
is this like? Did you incorporate, or are you guys doing?
No, we didn't incorporate. It was just something kind of on the side. We just, wanted to do something that, for the time being to help out. So we're still in the process. I think next week's going to probably be our last week because some people are going back to work, and we need off for the summer.
Yeah.
But
Yeah.
it's been a lot of work. I'll come home at 3:30 and I'll be home by about 4:15 in the morning, and then I'm packing bags up, getting the stuff ready for 9 a.m. that morning. And the kids usually kind of truck the stuff around to the front and set everything up for me. So
Yeah, oh
Yeah.
my God. Well, truly inspirational, and I really love the fact that just giving back to the community, and I've always wanted to do that. I mean, one of the reasons I want to, we created the company was to help fellow nurses,
mhm.
but now that we're stabilizing that type of economy, I do want to give back to the community as well. So we have projects in mind for the future, but we definitely want to help you if you need help. But if you're going to take a break, and if this ever happens again, we're totally
Sure,
behind.
absolutely. Yeah. Yeah. The support from the community was overwhelming. It was, I mean, my garage was in disarray. My husband was having a heart attack because we had tables lined up with food, and I'd have to, I mean, just the organizational time to get everybody's donations, and then going to the grocery store was difficult because there was a lot of caps on how much you could buy of certain things.
That's
But
true.
then,
I didn't think about that. That's
yeah,
crazy.
we had the eye rolls, and people like with we had like a cart or two piled to the top, and people were just looking at us. But after a while, the store that's down the street where we usually shop, they got to know what we were doing, so they weren't really too pressing on the caps per se. They were a little more lenient.
Yeah. Oh my God. Well, I
That's
just
awesome.
do want to thank you, though. Definitely want to really thank you for that. That was just
Sure.
honestly uh, really inspired me to do a lot more things to give back to a lot of people in my life as well. So,
Good. Thank
yeah.
you.
Yeah.
How's your
Def-
why travel nursing though? I do have to ask you that.
Wow. I think after all the years that I spent in the hospital of getting involved in like the politics of facilities and being that person, like, I worked for a very large facility, so I was basically a number. And
Mhm.
the politics, when you're there for so long, I just thought I needed a break. I got out of that, and I thought travel nursing wasn't first on my list because I was like I said, a creature of habit, and I don't do well with change. I like to be in my comfort zone, but once I started really looking into it, and I looked into, that there are smaller hospitals out there, there are facilities that actually care about their employees, there is more money, like I won't lie, the money we get paid as a travel nurse for
Yeah,
what we're worth.
exactly.
And but right now I can't see myself doing anything else full time other than travel, because I think I've been to enough facilities now where I feel like it's so cool to see the difference between one health system and another health system.
Yeah,
And what I thought for all the years that I was at a big facility was the rule, is not generally necessarily the rule. There's other ways to do things, and there's safer ways. There's just different ways. So I feel like getting to know different facilities, seeing different technology, actually made so many different friends that I still keep in contact with from my first
it's amazing.
one.
It's like
Yeah.
a mini adventure, like a
Oh yeah, it
travel
is for
adventure.
sure.
Yeah.
Yeah.
So,
That's awesome.
uh,
I do want to swing back to the other question we were talking about, because I don't think people heard what was the name of your organization that you were.
We called it Families Helping Families. So,
Okay.
and sometimes we refer to it as Families Feeding Families, but it started out as Families Helping Families.
Okay, awesome. And is this something that you created? Is it or a community wide type thing?
It wasn't like, it's not like an incorporated, nothing
Yeah.
like that. It was just something that we named, and we made a little poster and we had it put outside so that people knew that, what it was for, and, what we were, that, whether we were taking donations or we needed, to tell people that take one bag per family, because, people are people sometimes, but we had a really great response. And people generally did not take advantage of it. They were really understanding, and they wore their PPE up to get their bags and wore their PPE back to their car. So
Yeah, definitely. Another thing I liked about it is I saw that as it progressed, you started you started doing things for the children individually. You
Yes.
made little kits for them. Can you tell me a little bit about that?
We had some people who, actually a friend of mine who was, she said she was really bored at home and she wanted to make these kits for kids. And I was like, she said, well, could you include those in your grocery bags? And I'm like, that's an idea. So instead of doing that, she actually made these amazing, her name is Amy. She made these amazing, like large Ziplocs of like kit, like inside was like a craft with all the pieces that were needed for the craft and the instructions, and for all different age groups, which was really great. So we did put those out separate from our groceries, and they went bananas for them. People really liked those. So actually, we are planning on continuing that part of it over the summer for the kids.
Oh, wow.
So we actually have some kits out there that we're going to be putting together now, to start once our groceries are finished for the summer. We're going to do the kits for kids.
Oh, wow.
Yeah, I think that'll be great.
Yeah.
Since you're continuing that, how can people connect with you? Do you want them to find you on Facebook, or where can they go to connect with you if they want to join?
Facebook is probably the easiest way. Things that we're including are like crafts. We're including just general, like small activities, and I've been throwing in snacks for kids, like popcorn, like that they can pop for movie night. And we're trying to do more of a themed kit. Mm-hmm. So those are just little things that we've been throwing into the kits for them.
And where do you guys buy usually from? Costco or like different stores? Like, is there a major store you guys like to use?
Our groceries, we've been shopping at Giant, but for the kits for kids, I go to the dollar store sometimes, but I've been ordering from Oriental Trading Company because they have bulk and inexpensive things, and that allows me to get the exact amount, and then every kit would be the same.
Wow.
But we're generally not picky. Whatever people donate, we use. So
got it.
Wonderful. Well, listen, thank you so much. You're truly an inspiration. Love having you on the team. I was saying before you came on, I was like, I feel like you're one of our longest standing nurses. So I truly appreciate you for that.
Oh yeah, absolutely. I love being a part of your team. I've never felt more appreciated in my entire 18 years until I came to your company. So thank you for having me.
God, I appreciate that. That's beautiful to say, because that's how we want to feel, everybody to feel. We're a team. You don't work for us, you work with us, side by side. And we appreciate everything you're doing, honestly. And thank you so much for coming on. And
thank you for having me.
Yeah. Please like or subscribe our page as well. You can have notifications. We'll have many interviews like Melissa Calabria, Tommy Notoriani. Next week we actually have we're trying to get a psychic on, to be honest with you. And then we're also having what is Damien? The psychotherapy, right?
Yeah.
Yeah. So
we're looking forward to the weeks ahead, and like Diego said, subscribe, check us out, and continue to share with your friends. There's nothing like Access Healthcare, and like I say all the time, you need access to get in.
Definitely. So I'll see you next Tuesday.